Are surgical risks higher for people with sleep apnea undergoing anesthesia? Have you ever wondered if having sleep apnea affects surgical safety, especially when anesthesia is involved? Sleep apnea is a condition where a person's airway gets blocked during sleep, leading to breathing interruptions and low oxygen levels. This can pose significant challenges for patients undergoing surgery, particularly those who will receive anesthesia. Patients with sleep apnea face increased surgical risks for several reasons. First, they often have anatomical features that make their airways narrower or more collapsible. This can complicate the process of intubation, which is when a tube is inserted to help with breathing during surgery. If the airway becomes obstructed during the procedure or shortly after, it can lead to serious complications. Additionally, medications used in anesthesia can further relax the muscles in the throat, worsening the risk of airway collapse. This can result in low blood oxygen levels, respiratory distress, or in severe cases, respiratory failure. Moreover, sleep apnea is linked to various cardiovascular problems, such as high blood pressure and irregular heart rhythms. Anesthesia and the stress of surgery can put additional strain on the heart, increasing the chances of heart-related events during or after the operation. After surgery, patients with sleep apnea may experience more complications, including prolonged episodes of apnea, low oxygen levels, and a greater need for monitoring or breathing support. In the context of plastic surgery, where anesthesia is commonly used, it is crucial to address these risks. Before surgery, patients should be screened for symptoms of sleep apnea. If there is a suspicion or diagnosis of sleep apnea, the surgical and anesthesia teams need to be informed to plan accordingly. Anesthesia management may be adjusted to reduce the risk of respiratory issues. This could involve using medications that are less likely to depress breathing or preparing for potential airway difficulties. Postoperative care is equally important. Patients may need closer monitoring in a recovery area equipped to handle any airway or breathing complications. Some may requiring overnight observation or the use of devices like continuous positive airway pressure machines to help with breathing. Collaboration among plastic surgeons, anesthesiologists, and sleep specialists can enhance patient safety and improve outcomes. In conclusion, sleep apnea does raise surgical risks related to anesthesia, especially concerning airway management and respiratory function. It is vital for patients with sleep apnea to discuss their condition with their surgical and anesthesia teams to ensure the safest possible experience during surgery.